Hi everyone, this is Dr. Anthony Crifase, and in this short video, we're going to be going over a case study of the Vibrant America wheat zoomer applied in practice. If you have any questions, further questions on the details or the specific markers of the wheat zoomer, just please see the other video that we've made entitled Wheat Zoomer Explanation. So today we're just going to be going over a case study applying the wheat zoomer. So just a disclaimer, this case study is not intended to treat or diagnose. This information is provided by Chicago Natural Healthcare and is not intended to replace the medical advice of your doctor or healthcare provider. Please consult your healthcare provider for advice about a specific medical condition. So we had a patient that came into our clinic. She was a 36-year-old female. She actually came in for an annual checkup. However, she did report having some current symptoms and previous health conditions, and these included current depression and anxiety, hypothyroidism, a history of hypothyroidism with nodules that were previously removed. She had postpartum mood swings, so she had her third child a year and a half prior. She was having consistent headaches, poor skin, and a history of ovarian cysts as well. So we decided to do some laboratory testing on this patient, and which included some comprehensive blood markers, including a CBC, a complete blood count, a CMP, a comprehensive metabolic panel, a complete lipid panel, a full thyroid panel, and then inflammation markers as well. We also decided to do some genetic variant testing on her, which included the MTHFR gene, which is very common in our population now, as well as the Vibrant America wheat zoomer, which includes the leaky gut testing. For the sake of this video, we're just going to be going over the results of the Vibrant America wheat zoomer results, and then going over some outcomes and results that the patient experienced. The current medications that this patient was on were Zoloft, which is primarily used as an antidepressant medication, but sometimes for other purposes, as well as buspirone, which is primarily, again, an anti-anxiety medication. So slightly different, but the patient was on both of these, and she was just not getting the results that she wanted, and she was still having some issues going on. Previous treatments that were rendered, she was currently working with an OBGYN and also a psychologist to deal with not only the anxiety and depression, but also some of the thyroid issues and the headaches, as well as the ovarian cysts. She was also on the Whole30 diet, which she had just begun about 2 months prior. So here are the results, the first page of results of her Vibrant America wheat zoomer. And so just want to start off with, and again, if you have any questions on specific markers, we encourage you to watch our other video, in which we go in depth on each section of the wheat zoomer and just really give you a general good idea of what the wheat zoomer really entails and assesses. But really quick, we want to just talk about this first section here, which is total immunoglobulins. Now, the really nice thing about the wheat zoomer is that it includes this total immunoglobulin section, and this is important because if our total immunoglobulins are off or decreased or elevated for whatever reason might be, this can skew the results of the rest of the test. And so we want to make sure that she has adequate immunoglobulin status so that we are getting reliable markers for the rest of the panel here. So as we can see, we did have a good status for the immunoglobulins. And again, we have different types of immunoglobulins, the IgG and IgA, which we do go in further depth on our other video explaining the wheat zoomer in detail. So as we can see, we go down to our celiac panel, as well as our TTG and DGB complex. Now, the celiac panel, traditionally, as we've talked about in our other videos, talks about and goes over transglutaminase 2, as well as DGB, which is deaminated gliadin peptide. So as we can see here, she does not look like she is at current risk for celiac based on these markers. They are not necessarily near the out of control range as well, so that is a good thing. And the complex just below the fusion peptide of TTG and DGB indicates that she is at a certainly lower risk in the future. This complex, again, is able to detect from 14 months up to 4 years for the progression of celiac, not necessarily the diagnosis. That often can occur many years later for patients with celiac. We're just talking about the progression, so that's great markers. But we want to just jump down to her abnormal markers really quick on the intestinal permeability panel, which is, again, the leaky gut panel. Now, as we can see, the anti-actin IgG is certainly out of range. It is in the high risk range. And so what we know here is, first of all, that we do have some sort of inflammation. Now, Vibrant has been able to isolate a specific form of actin, which is F-actin, out of the gut for this panel, which is very great, as you have many different places that actin is in the body and complexes with other proteins. And so as we can see here, based on this anti-actin IgG, we know that because it is actin, we have some sort of inflammation within the epithelial lining in the gut. And because it is IgG versus IgA, we know that this is a systemic and a chronic exposure type of thing going on. We know that IgG, remember, is more long-term exposure, whereas IgA is a little bit more short-term exposure. And IgG, again, is more systemic. IgA is more localized to the mucous membrane linings found in the gut, lungs, esophagus, etc., around the organs, etc. So as we can see here, the anti-actin IgG is certainly out of range. So we know that something is going on. Now, when we look at anti-zonulin IgG as well, while this says it is in control at 0.84, we know that this is getting close to the out of control range, which would be 0.89 to start. So this already, we know that a little bit we might be having an issue here as well. So, based on this marker, we got to be careful here as well. And as if we go down also to anti-LPS, this is a little bit getting up there as well. So, and remember, anti-LPS is the endotoxins. These are toxins produced by bacteria in the gut, which can further potentiate a leaky gut and cause inflammation. So as we can see on the next page of the wheat zoomer here, on her transglutaminase panel, her transglutaminase 3 is relatively lowered, but again, her IgGs are relatively consistent here. And we want to make sure, since she was having a little bit of these depression and anxiety, no necessarily cerebellar issues or neurologic conditions per se, but with these issues, our transglutaminase 6 can sometimes be elevated as well. So we want to make sure that those were good there. Now, if we go down, let's go down to the gliadin panel. So we can see here that we definitively have a gluten sensitivity. Our gliadin, remember, is one of the proteins and a subprotein of gluten. Now, the major gluten proteins you can think of as gliadin and glutenin, which we'll go over as well. But commonly for a gluten sensitivity panel or celiac sensitivity panel, they will check only alpha gliadin IgG. And as we can see here, that alone is out of range. So we already know that there is indeed a gluten sensitivity. As we can see though, we have a trend here as well. Our alpha beta gliadin IgG, again, is also out of range. And then we would go down, our prodynorphin IgG is also significantly in the high risk range. But really quickly, before we go over prodynorphin, we can see that if we look at our IgG markers here, our alpha gliadin IgG is out of range, our alpha beta gliadin IgG is also out of range, our gamma gliadin IgG is getting close to out of range at 0.75, our omega gliadin IgG is getting very close to out of range at 0.87, and our gluteomorphin is relatively low, but as we said, our prodynorphin then is high. So we know that this is again, a systemic and a chronic long-term exposure type thing occurring, and it looks like it can be progressing as well with this patient. Now, significantly though, the most significant here is this prodynorphin IgG. Now, as we know, the gluteomorphin and the prodynorphin will affect the opioid receptors in the brain, and as such, patients who are eating gluten on a regular basis can have a euphoric feeling from eating gluten. And when they stop for a day, they may get depression, anxiety, essentially withdrawal symptoms. This is known as gluteomorphin withdrawal response. And again, this is because they're opioid receptors. This would be similar to if someone was taking opioids, they stopped for a day, they could feel anxiety, depression, brain fog, etc. So very similar. And as we know, gluten has been associated with hitting opioid receptors for a long time. We know that the ancient Egyptians, again, used to use gluten for opioid salves, essentially put it on wounds. They can use it for opioid withdrawals as well, gluten. So very important thing to remember here, and that prodynorphin though is elevated. And this patient, the significance is that she was having anxiety, depression, consistent anxiety, depression, mood swings, etc. So big important marker here, as well as we will go over, this patient did have a little bit of an issue removing gluten, which can be explained here, as these patients who have elevations in these can have a little bit more difficult time. On the last page of our wheat zoomer, we can see that we had some elevations in our non-gluten wheat panels. And really quickly, the section above actually is the glutenin panel. And as we can see here, the high molecular weight HMW glutenin IgG, again, is getting closer to that higher risk range. So again, this is not as well researched as gliadin. Glutenin is not well researched as gliadin, but still an important marker. And if we did have glutenin out of range, this is again is indeed a gluten sensitivity. So as we can see though, in this next section, the non-gluten wheat panel, again, we have significant elevations and out of ranges for these as well. And again, we can see a trend here. So before we go over the specific ranges here, we can see that serpin IgG is out of range. Farnin's IgG is out of range. We can see that amylase and protease inhibitors IgG again is nearing that out of range. We can see that our globulins IgG is also getting there. So again, we know that this is a chronic exposure that we're dealing with, that we're having a sensitivity to. So again, we have differences. Somebody can eat foods and they can have short-term exposures, which would be show increases in potentially in IgA. And then, but if we're having long-term sustained issues, our IgGs will consistently be elevated. So as we can see here, this again is our non-gluten wheat panel. So, and it's important to remember, we have patients who go on on gluten-free diets, and they may eat certified gluten-free foods. But again, some of these gluten proteins are hidden in gluten-free foods and in other foods that you might not think have wheat in them. But again, these are wheat proteins. So we indeed certainly have a wheat sensitivity here as well. So we can see the serpins are elevated, the farnins, and then the purinins as well. So with this patient, we followed some guidelines here. And for our clinical and lifestyle guidelines, these again were specific to the patient. And this is very important to understand that for all of our patients, we treat the patients and we help to manage and support the patients. And so each program and each protocol is specific to that patient. So for this patient, we had her continue on a Whole30 diet, but we did a little bit of modifications and reintroductions. We also did some leaky gut repair. So as we know that if we look previously, we did indeed have some leaky gut occurring, as well as gluten sensitivities. Now we know that gluten sensitivities and gluten will perpetuate a leaky gut and will make our leaky gut markers worse. And so this is a problem because now if we perpetuate leaky gut, not only will we start reacting to wheat and gluten, but we may start reacting to other foods, toxins, things in our environment, water, etc. So we wanted to make sure that we are fixing this leaky gut. Now, in addition, we wanted to give her some targeted detoxification support, which we did, which would help not only regenerate her gut, but also her liver. Because with consistent gluten sensitivity and other food sensitivities, this is chronic toxin exposure into the body. And so this now can overburden our detoxification processes and therefore give us other issues. We also, again, we gave her some thyroid support. Now, for the sake of the video, we did only go over the wheat zoomer, but she did indeed have some abnormal thyroid markers, as well as abnormal lipid panel and some other things that we went over at the beginning of this video. So we gave her some stuff to support the thyroid in specific ways. She also was indeed homozygous with the MTHFR gene. And so with this can also was adding to her anxiety and depression. And we also included some daily walking, light aerobics, and some other lifestyle activities for her to do. The outcomes that this patient experienced were significant. Her depression and her anxiety subsided relatively quickly. Her thyroid markers balanced out. Her mood swings and headaches improved pretty quickly as well. She went from 165 pounds to 135 pounds in just 2 months, and she had major increases in energy and mental function. So by doing all of these things that we addressed with this patient, she had significant improvements. And this is the really great thing about the Vibrant America Wheat Zoomer, in that we were able to really identify not only whether there's a gluten sensitivity, but whether there's a wheat sensitivity, whether she is progressing towards celiac or away, which again would predispose her to other conditions and allow us to see whether this was really affecting her life. So if you have any more questions, if you have any questions or would like any more information or to become a patient, just go to our website, www.chicagonaturalhealthcare.com, and we'll be happy to answer any questions you have and help you out in any way we can, and we hope to help you live your best life possible. So again, thanks for watching and have an amazing day.